Well, if a deal isn't struck in Congress, health care will be more expensive for millions of Americans next year. That's because tax credits tied to the Affordable Care Act are set to expire in 2 months. On top of that, health care premiums are spiking for employer-based programs, too. A study conducted by nonprofit KFF finds that the average health insurance plan for a family just under $27,000. To discuss this further, we want to bring in Dr. Anahita Dua, a local surgeon, also founder and chair of Healthcare for Action. Thank you for joining us here. We appreciate it. And I want to start by talking, though, first about the rise in healthcare costs. What's actually leading to the spike this year?
So the big thing that's leading to it is the lack of the subsidies. So basically what happened is we had the Affordable Care Act, and that said that we're going to have a number of new people that are going to be covered by insurance, and that's going to basically pay into the pot that can support others who actually are going to get insurance, which I know is a bit confusing, and in a lot of ways that's part of the problem. But once that occurred, it became very obvious that people were going to have difficulty paying the premiums, and Congress on a federal level passed a bill that said we're going to subsidize some of this money. So you as the state pays a little bit, you as the person pay a little bit, and then the federal government was going to pay a little bit, and ultimately that was going to get people covered. Unfortunately, that subsidy, so that little bit of, the coupon basically for insurance expires now at the end of the year. And so by January 2026, people are suddenly going to get an increase in the premium, which is the amount of money that you have to pay to get covered. And it's quite a significant amount, to the point you made earlier, up to $27,000. And there's data out of the Fed Reserve that says most families cannot even absorb a $400 increase, let alone a $27,000 increase.
Yeah, it's definitely an extra burden for sure. You mentioned confusing. Correct. It is confusing. I like how you explained it, though. What would you tell people who are about to sign up, though, for the Affordable Care Act, either those maybe just looking to get on for the first time or renewing their benefits during open enrollment?
I'll tell them one big thing as a surgeon. Unfortunately, in the United States, the #1 cause of bankruptcy is medical bills. It's so sad, but it is true. And so the most important thing is that in spite of all this terrible stuff that is going on, ensure that you get coverage and that you keep coverage if you are already on this Affordable Care Act or if you are on other types of insurance. Because if something happens and you get hit with a bill, that can be devastating to you and your family. So there's what we need to do right now, and there's what we need to do as a country moving forward. Massachusetts is amazing. Massachusetts has your back. We have mahealthconnector.org. Everybody should go on there and basically first take a look at how much you are actually paying, because a lot of people don't even know how much the government is subsidizing their insurance. Once you find that out, you can at least see how different your premium is going to be, and then ensure that you do sign up, and then be politically active to try to change the way in which we're managing insurance in this country so that you can actually get coverage for you and your family moving forward.
And of course, as healthcare, it's getting more expensive. As a doctor, are you concerned that people might just decide not to go see a doctor for any preventative care? And then could that cause a chain reaction of some kind of sorts, where more people end up in the ER and overloading the hospital systems?
Oh, well, absolutely. I think the biggest effect, I get asked that a lot, what's really going to happen with this? And we throw out all this political mumbo jumbo. The real thing that's going to happen is people are just not going to do it. Not because they don't want to, because they literally can't. Who can just throw down $27,000? Nobody. And so at the end of the day, what happens is people do not get insurance, or they avoid coming to the hospital for things that maybe they could have gotten taken care of at an earlier stage. So, unfortunately, somebody may have a lump in their breast. They say, I just can't afford it. I'm not going to go check it out. 1 year later, it's full-blown cancer. And this is not to scare people. This is what's happening. I'm sure your people listening right now can say, yeah, I agree. Or they don't want to come to the ER, maybe not even because they can't afford it, but because they don't want to sit there for 10 hours. And they know because the ER is overloaded, that's what's going to happen to them. And indeed, that chain reaction will lead to people being sicker, and therefore the cost of their care being more when they finally are emergently pushed into it. That overloads the hospital, overloads the doctors, of course, and again, to your point, the chain reaction that affects the entirety of healthcare. So this is something that needs to get fixed immediately, and our government needs to step up and do a good job with it.
Yeah, and then potentially also putting that person, the patient, in more medical debt if they already are. You kind of mentioned this earlier. There are some types of programs out there, specifically here in Massachusetts. But in your opinion, is there even a solution to this problem? I know it's all kind of webbed in a way.
In my opinion, I think we need to rehaul this. We can't keep putting Band-Aids on things. At this point, the way we do reimbursement, the way we do insurance is so messed up in the United States that it needs a full overhaul. And if I was in charge, I would basically bring a number of intelligent people into a room and say, let's sit down and figure this out. If we can put someone on Mars, we can definitely figure out health insurance for our people in the richest country in the world.
Very nice. All right. Well, we really do appreciate that perspective. And I know a lot of people, a lot of Americans, a lot of people here in Massachusetts impacted by this. It's a lot of money. Dr. Dua, thank you so much for breaking it all down for us. We appreciate it.